All right. Well, everybody who's on the call, thanks for joining. Apologize for the technical issues. I want to introduce Ben Vigoda. Ben Vigoda did his PhD at MIT, and he was also an alumnus of the MIT Media Lab. He's also founder and CEO of Gamalon Inc., which is an AI startup here in Boston. Ben, I wanted to chat with you today. You are obviously a very numerate person, and you have been, like everybody else, thinking about COVID and thinking about the data behind COVID. Can we just start off by talking a little bit about what you as a person with a company and with a family and as a human being surviving during these times, how you've been coping with it in terms of your bias towards action, your desire to jump on a problem and maybe think about what you can be doing to help the situation?
Yeah, I mean, there's a kind of maybe a sense of powerlessness that comes from this situation. It's obviously much bigger than all of us, right? So we just do any little bit that we think we can. We were lucky enough, partly because of you, Robert, to know that this was coming earlier than a lot of other people maybe appreciate it. That was partly because of Robert's knowledge of Chinese and his knowledge of statistics and epidemiology. And he first made me aware of COVID. So yeah, it's just been watching this roll through and then thinking, is there anything that we can do, even if it's just for our local community, our friends, our family, our coworkers.
So from a modeling standpoint, I know you have modeled the data somewhat. What kinds of things have you been doing? Who have you been talking to? What have your modeling efforts look like on this problem?
Well, I mean, in the beginning, back in February, it was really, so I'm CEO of a startup, Gamalon, as you know, and I felt a responsibility to make a decision about when to turn the company into a remote work company and when to close the office. And I wanted to make that decision in some kind of responsible way, because there's a cost associated with every change. Cost to maybe productivity could have happened, and obviously I have a responsibility to shareholders to. But at the same time, obviously first priority is keep everyone safe. So back then I just made some simple sort of back of the envelope calculations and looked at the doubling rate and assumed that, for the, this back in February, assumed that, just what would happen if the doubling rate kept going like that. And I think on February 3rd, I just emailed the company and said, I think somewhere around March 15th, we're probably going to have to stay home for a while. That was really just a back of the envelope calculation at that point.
So it's actually interesting. So right now, the politics around modeling itself has changed. We have people in politically influential people who are saying that we can't trust models and we can't trust the modelers, and it's tempting to go there and say, well, you're being anti-scientific or you're being some kind of numerical Luddite, right? But on the other hand, a lot of us aren't really that good at modeling, even those of us whose job it is to model things. And so we don't know who to believe. And there's also how one goes about modeling, right? Like, so you did a back of the envelope calculation based on costs specific to the company that you run. And you didn't actually fit any data. You just did something like a simulation of a doubling rate and just said, okay, let's just project this forward. What happens if something doubles like this? It's a lot like, a net present value calculation or a I don't know, a compounding interest calculation. You're not trying to forecast the future given some set of data, but you're rather just looking at some core assumptions and just projecting forward. And I think that's really interesting I'm trying to understand if there are things to take away there. Like does maybe one when making decisions like this should just keep things that simple and not try to fit a whole bunch of data sets coming out of Singapore and New York and all over the world, but rather just say, all right, let's just put this in Excel and just drag it down and see what it looks like in 10 days.
Well, I mean, I mean, technology has something to, math has something to teach us, and so does just um, being a human leader, right? And so, I'm a blend because I'm a CEO, but I'm probably a little bit unusual because I'm the CEO who's an expert in statistics. But in a decision like this, I'm trying to not be a technocrat. I'm also trying not to operate as a Luddite either, right? I'm just trying to make a good decision, and I'm trying to do it in the most the least fragile way to make the decision, right? So simpler models better. Look at a problem a couple different ways, get to the same conclusion is better. Look at past experience of Italy or at that time or China. Okay, that's good. That's solid. I mean, it seemed to me we should be data driven, but not data ruled.
What does that mean specifically? Not data ruled, like that our decisions are.
Yeah, it's easy to overcomplicate these things, or try to do complicated science on it, and sometimes you need that. And for people who are doing, certain kinds of detailed forecasts, that needs to be. But I was just trying to make, most of my focus has been on trying to make good decisions for my family, my company, my extended family, my friends. To not decisions for my friends, but to pass that along. What my decisions were and what my thinking was. So just to be kind of grounded about that. At some point, the back of the envelope calculations weren't quite accurate enough for the decisions I needed to make. So the first decision was just to shut down the company. That I could do with the back of the envelope calculation. I knew was coming, and just a back of the envelope calculation with standard just taking the doubling rate and just saying there's this many people infected in Wuhan, China, what'll happen, when can we expect it to come to Boston? I got it within plus minus 3 days. The thing about doubling is you can't be off by very many days. If something's doubling every 3 days and you estimate, you're gonna have to shut down your company on March 15th, maybe you got it wrong to March 18th or March 12th, but if it's doubling every 3 days, like there's not a lot of slack.
Okay.
3 days and it doubles, right? So that was easy.
Did that factor into your decision though? So like you're saying like, well, okay, here is a forecast of when it no longer makes sense to have the office open. But if I'm off by, if I look at my kind of margin of error here and I see like if I'm off by this much, then I'm really off. And so because that's the way doubling works, right? Like your margin of error is very asymmetric. And so if you could, did that impact your decision? So that, okay, well, let me just assume that I'm off and then disclose 2 or 3 days earlier. Like, is there some kind of heuristic for decision making that kind of factored in when you were thinking that?
Yeah, I just figured like I could be, with doubling, you could be very off on the number of people infected on a given day. You could be a half, 2x over, you could be off by a lot. But in terms of the number of days you could be off, you can't be off by very much. If you ask when are you going to be past, 25% of the population, to have the disease, then, if the doubling rate stays at every 3 days, then, you can only be off by a few days, plus minus. So most likely. So, yeah, I just kind of erred. I said when there were 20 cases reported in Boston that were P2P cases, that were person-to-person transit, not just like someone flown in for quarantine at MGH for special treatment, but like actually people on the MBTA spreading it to each other. That was our trick. It was very simple. We had a greenfield population. People were reporting cases in a very straightforward way every day. And we just picked a threshold where, the one thing I did do is just look a little bit at the data to figure out that it seemed like at least every reported case probably equaled at least 10 unreported cases. And so I figured, and if you've got people on the T, those are the people transitioning it to each other. If there's 20 reported cases, maybe there's 200 real cases, maybe there's even 2,000 real cases. That's enough that an employee, a team member could encounter somebody in a train car or something like that. It seemed like the better side of, but it seemed early, and 20 was pretty low, so it seemed like pretty safe at that point to, but because of the margin of error, you didn't want to delay that decision.
Yeah, I think there was a post recently by Gary Marcus about how we shouldn't be reporting the number of confirmed cases. We should be reporting the estimates of actual cases, which to me as a statistician doesn't really make sense, because not because we shouldn't do it, but because how do you estimate some greater population from a clearly biased sample, where we're just kind of we're conserving tests for people, even symptomatic people are not getting tested. So that seems like a great example of, this is where you kind of use back of the envelope thinking and just say like, okay, what if it was this? What if it was that? Okay, worst case scenario, let me create a tripwire. Like you said, you created a tripwire for closing the office, and you just waited for that tripwire to get triggered.
Well, I mean, as Bayesian modelers, we know that there's kind of two steps. One is get the posterior likelihood of something, and the second is make a decision on what to do based on the probability of something being true or false or whatever, or being some value. And the first is estimation or prediction. The second is decision theory. And it's a separate theory, right? And so when we go to the decision theory, we take as inputs the posterior probabilities, and we also take as inputs the cost of not doing something, of doing something, but having a false positive. And we make that decision based on a cost benefit analysis of making the wrong decision, doing something based on a false positive, false negative, that kind of stuff. So that decision theory is really different when we're making a decision for our own company, our own family, versus when we're publishing something for the population. If I'm the U.S. government or a respected epidemiological group, and I'm publishing something for the population, my cost-benefit analysis is different. So for my own family and for my own company, I agree with Gary Marcus. I've been using estimates of how many actual cases I think there are in the population, irregardless, like going from the reported cases to what I guess are the real number of cases. And I can fit that. So the way you fit that in a model is you say, well, look, here's what we know about the spreading. People are infected for this length of time, are infectious for this length of time. We know there's this many reported cases. If on day one there are one case, and then 3 days later there are 2 cases, and those people never met each other, then there must be some other cases that carried the disease from person 1 to persons 2 and 3. And we know that's the case in many situations. So it is possible to get an estimate of unreported cases. And now, for example, the Broad Institute just did a testing of, I think, 1,000 people across assisted living facilities in the Boston area, and some were clean. They had no positive tests, and some had 25%. Or at least one facility had 25% of the people. Many were asymptomatic. So but it's not. But it's pretty flat posterior. It may be that in some locations there's 10 unreported cases for every reported case. Other places there might be 100. It depends on how much testing is available, how the demographics of the population. Younger folks seem to be less symptomatic. So But if you're in Middlesex County and you're trying to estimate this for your friends and family, and you don't care that the posterior is wide, when there were 20 reported cases, I figured maybe there's 200, maybe there's 2,000.
Yeah.
Tomorrow there'll be 100, 4,000. That's still too many. We should shut down. But if I were a government, maybe I wouldn't make that same calculus. Maybe I wouldn't report that same thing, because now I'm reporting something that's very uncertain.
And yeah, I mean, and we're getting more, so we're getting a lot of data kind of confirming that kind of thinking. I think on the 17th, there was an article in the Globe about 200 people who had given blood samples on the street in Chelsea. A third of them tested positive for the antibodies associated with COVID. This is not diagnostic test. This is the antibody test.
Yeah.
And so that's a shocking percentage of people who who likely got the disease and then either didn't know it or symptoms were too mild to to warrant going and getting a real test.
I agree with Carol, but I think when you have the decision,
repeat that. You get cut off for a second.
Marcus said about estimating the unknown, or the latent cases, let's call them. If you're making a decision for yourself, I think it makes sense to estimate that. If you're reporting that number in the New York Times, my experience has been that people are going to read that different ways, right? And so, and you also have to make sure the reporting would report the posterior, the error bars on that estimator. And how you visualize that even can influence people. So it's great care that gets much higher bar.
So speaking of that kind of prestige bar, right? Like there's plenty of people out there who have good quantitative chops, and they're doing what they know how to do, which is model the data, and then they're sharing these Jupyter notebooks or writing Medium posts. Is that useful? How do we know who to believe or which models to trust? How important is it so you, as somebody who has, say, affiliations and a professional network in institutions that are kind of household names, does one need to leverage that to get the word out? Should we even try? Should we just say, you know what, I'm going to worry about my company and my family and my friends, and I'm going to share this analysis with them? What should a data scientist do?
Well, I mean, first of all, we should identify what problem we're trying to solve. Whenever we're building anything technologically, we should start with the human problem, and like the technology is at the service of us, right? So, if the problem we're trying to solve is just to help our friends and family or make our own decisions, that's one thing. Right now, there's a lot of discussion, like the decision I need to make at Gamalon is, when are we going to reopen? Or what are we going to do in terms of remote work? That's a decision I'll have to make. A lot of organizations will have to make that decision, or similar decisions.
I want to clarify to people listening, Gamalon is working, is open. It's just that people are not in the office, potentially affecting each other.
Yeah, so we're in a lucky situation where we can remote work because of the nature of the work that we do is over computers. And but there's a lot of businesses and organizations that can't do that. So the reopening question is a lot more critical for other organizations. Or said another way, the decision theory of a false positive, a false negative, doing something, not doing something, has higher costs or benefits, or more extreme differences in terms of opening, not opening. So my decision might be really different because my cost benefit analysis is really different than a restaurant. But every organization is going to have to make this decision. And we're probably going to have to continually make that decision for the next, I don't know, everyone's understanding of this is a little different, but until we have antivirals or vaccines or or we find out that the mortality rate is much lower, it's okay, or whatever, until some point where we have new information where you have to ride the lever of social distancing, and we have to figure out how to put our foot on the brake, on the gas. And it seemed there was an article in MIT Tech Review that basically said, maybe that's going to be 12 or 18 months or even 2 years. And the way that people will, barring any new information or way of doing this, the way people will do that is they'll look at the number of cases that are currently in, say, like the Boston area intensive care units. And so you say, all right, well, if there's this many new cases in an intensive care unit, that's telling me we need to do X. Maybe that's
so creating tripwires.
Maybe, like I said, every organization might treat it differently based on their cost-benefit analysis. But we created
I like the strategy of like having the tripwire in advance because it's proactive from an organizational standpoint. If your employees kind of see you reacting to something like, okay, the governor did this, or these many people died, or people are freaking out, only then do you react. I think that makes employees kind of, well, it doesn't put much confidence in the captain of the ship, right? You should be steering us away from the glacier, not waiting until you see a glacier before you start making decisions. And so exactly right. Like that tripwire approach, we're saying like, okay, this many things happens at the hospital at before this date, then this, way in advance of those things happening. I think that's a really clever way of going about it.
I mean, that's fundamentally leadership, right? Is to proactively lay out a policy and get ahead of things and communicate to people in clear terms, how you're looking at stuff, and then ask for feedback, and then, determine a path before it's upon you. That's how you steer a ship. I wish that we were seeing more leadership of that kind, but I aspire to, I think the goal is to try to do that for our organizations that we are leaders for. And every one of us is a leader of some organization, whether it's an organization of one or of our family and friends or whatever that is. And especially as data scientists, we have a kind of implicit leadership here because we're a little closer to understanding the data. So I agree with that. I think we have to, whether it's a tripwire policy or some other clear way to delineate future actions, that's really important. And I think, right now that's kind of difficult. So it's important to do. It's also a little tough because, the first tripwire we set was 20 people in Boston, P2P transmission. We're going to work remote. That was good for Gamalon. Now, if 20 cases showed up, it's a little more complicated. Was it 20 cases in one day? Was it 20 cases spread across a week? Were those all cases in one school where one person got sick and everyone else went and got tested, or one place or one business or one office or whatever? Or were those 20 cases that were kind of spread across say Middlesex County with no clear connection between them? And how would we, and maybe they do have a connection between them. So contact tracing will help with this to some degree, and that's my understanding is that is where the Carnegie Mellon University group and the CDC, as well as most of the state leadership is focused is on getting contact tracing in place. But you can't trace every contact perfectly. So there's always going to be, contact tracing is a very deterministic, not a very statistical way of thinking, right? It's basically saying like, let's find clear causal connections, with, essentially deterministic causality, and trace back to the latent causes of, where'd you get this from? Oh, you got it from that person, or this, or who'd you maybe give this, might have given it to these people. But other thing is that we know that there are some new data sets arriving. So some of the big tech firms have data sets that tell us in general, on average, in a region, like whatever, a zip code or something like that, a county, how much are the phones sort of mixing with each other? How much are they moving around? Just like when you stir molasses into some batter, to make a cake or something, you don't trace where every particle goes, but you can see when you fully mix things up, halfway mix things up, or just haven't mixed things up. And it's possible. We now have data sets that are coming now to some of the top universities, and in the next few weeks will be made available, I think, on GitHub, like open source, from a lot of the big tech firms that give some of those mixing understanding.
So an understanding of how much people are moving around from mobility data, and it's not individual level, but it's more kind of aggregated to the level of a region that's small enough to understand how much people are mixing and potentially affecting one another within that region. And so,
well, it seems like, yeah.
So to me, the question is like sorry.
Well, so if you do get 20 new cases in the intensive care unit, it's a very different situation if no one was mixing, and you get those cases, and they're all sort of randomly spread out, and there didn't seem like there's a lot of mixing. It's like, how'd that happen? Or if there was a lot of mixing, like everybody was out and about, social distancing was turned off, we're all back to business as usual, and you get those 20 cases, okay, and they're totally spread out, that's another thing. Or if you get 20 cases in one office, and there's, some amount of mixing in the population, so you say, okay, well, the diffusion coefficient from that office is probably X, some amount, and so that now that we've seen 20 cases in that office and we know we have this diffusion coefficient, we know how much sort of general mixing is happening, we can probably guess that, there's another 100 people out there or something who may have come into contact. We don't know who they are. We haven't done the contact tracing. It's a statistical estimate.
So you as a CEO will use this data on local, say, movements in Boston during social distancing or during stay-at-home policies, or to project when it makes sense to, or you'll be using this data along with reported statistics to make decisions about your business. It seems almost as though there's a missed opportunity here to, with this type of granularity of data, one would want to create some kind of reporting mechanism for local governments to make these decisions. But it sounds like one thing we've learned in the last week is that might be politically futile. Do you agree with that?
Well, I think that, going back to the Gary Marcus point and the decision theory, the cost benefit analysis point, every organization is going to look at those numbers or look at what's happening and maybe make a different decision based on their own cost benefit. And not every organization has the same, like Gamalon has sophisticated data scientists and machine learning experts who have, the ability to dig into data and code and see how much we believe something, but, the average restaurant does not. So, I think that it's a little I'm not in a position, for better or for worse, where I need to make that decision for Middlesex County. So, if I were doing that, I don't know how I would go about that exactly. But I think what we can do is, I'm planning on and have been modeling this, and I have some friends at some of the big tech companies because of our, friends from school or business relationships. And so we've gotten early access to the mobility data and the mixing data. And So I think, what we can do is obviously make our efforts public, visible. It's not keeping anything private to ourselves, but I think it would be presumptuous, or to say, here's what you should do. I think what we can do is say, here's what we're doing, here's the assumptions we're making, here's the model we're using. Here's our sort of cost benefit analysis. It doesn't really cost us as much as many organizations to go and work remote. So maybe we're more biased toward doing that. But here's what we're doing. And then if everyone can kind of look around at each other and get those kinds of inputs, we can decide who we want to believe. And
so it's almost like a security style. So in security, you want to see something secure, you make the source code available so people can look at it and say, oh no, actually here's a problem, you got a vulnerability here. And so you're saying, like, you're not going to go and say, tell the governor when he ought to or not open Chelsea, but you'll do the analysis and you'll make the code available and open source, and you'll provide the insight that you're making to people within your professional network. You'll make the insights that you're making kind of obvious from the source code that you're making available to other people, and that's well enough. If our institutions function well, they should be able to seek out and find these types of analyses. Same way people who are interested in security can find ways of making sure that the solutions that they're using are robust, by making things available and not keeping secrets, I suppose.
Exactly. I like the security analogy a lot. I think that that's a really good analogy. Linux is a perhaps more secure operating system because, it's been argued people pour over the code and it's that visibility creates a robustness, right? It decreases fragility. There's just more ways to be right and fewer ways to be wrong if more people are trying.
I wanted to ask, are there other mechanisms we might use? So a few weeks back, I had Thomas Wiecki on, and he is the VP of data science at a company where people submit trading algorithms that's validated on backtesting data and then internally validated on some holdout data, and then they'll create a kind of ensemble of these algorithms to make decisions. Is there some markets we might create for COVID-19 model-based decision making, and what would that look like? And we're spitballing now, but.
Well, I too have been thinking about that, because actually I started to sit down to start to build a model around the mobility data from some of the big tech firms and some of the other data that's available. And I started to realize there's a lot of people doing that now. And not to mention large numbers of data scientists within some of the big tech firms who are doing their own efforts. The biggest contribution we might be able to make for ourselves right now is to actually consume all those models. So just try to understand which models can we believe, and maybe there's an ensemble of models we can boost together that give us a better understanding. Just at the beginning of working on that, but I just started writing a few simple, like just Jupyter notebooks to see if we could bring together multiple models and multiple data streams into a single estimate. It's sort of the kayak style of airline. You go to United Airlines or something if you want to buy an airline ticket, but you can go to Kayak or some other, whatever, Travelocity, something like that, right? And they search all the airlines. And so, a lot of times you can get a better price that way. So these prediction markets are really
We'll close soon. Now, if people have questions, please ask them in the chat window. Sorry, I think I just cut you off. I thought you had finished. But yeah, I mean, there's political prediction markets. There's markets where you can go and long or short, take a long position or a short position on Donald Trump winning in November, for example, or Brexit happening by the end of the year. It'd be interesting to see if something could be made not just about COVID outcomes, but rather about models about COVID outcomes. And so we have to define a metric, and I suspect that forecasting accuracy is not the right metric there, but some metric that evaluates how useful the model is in actual decision making, the kind of decision making that saves lives. I don't know what that looks like, but it's a mechanism that that exists.
One idea for what we're trying to estimate. So I think it's always valuable to work on posing a problem, so that we can then all work a problem. And so I think one thing that might be starting to emerge as a consensus, what are we trying to predict, or what is the thing we're trying to estimate? What's the number, the value, the variable? You're in a very different regime, and I'm not talking about, for those who are familiar with R sub t or R sub 0, not talking about that per se, but you're in a very different regime if you're in the exponential regime in your local zip code, let's say, where whether it's a day, a week, 2 weeks, you're going to double. That's a very different regime than if you're not going to double. It's going to be linear growth, or you're going to be, stochastically constant. Just kind of a constant stationary noise process. So you find out which you're in. Within a couple weeks or 4 weeks, you're gonna know. So these are not very long-term forecasts that we need to make, at least for deciding whether to open or close or social distance or not. If we're trying to predict 3 months out, the price of oil or the availability of face masks, which might be important things to estimate, that's really different. But if all we're trying to do is do closed loop PID style control on when we social distance and when we don't, we really just need to know a Boolean variable. Is the exponent of time to an exponent, is that exponent greater than 1 or not, right? Are we growing or decaying? So and it's, like any Lyapunov exponent, it's sensitive, it's very sensitive. So we should be able to, it's like getting the slope of the line at the moment. We ought to be able to get that to reasonable, at least to like 0th order, which is just a Boolean estimate. Are we above or are we below? So that might be what we're trying to make a prediction of market about. Are we exponential or not in Cambridge or in Middlesex County or good?
I wanted to make a correction. I said that article on estimating infected rates was by Gary Marcus. It's by Gary Marcus and Annie Duke, the famous psychologist / poker champion. So I would give credit where credit's due. We have some questions. One question from Sneha: how do we model the effect after reopening society? Do we tell with some confidence value how safe it is to reopen society? So yeah, so maybe rephrasing, how do we quantify the effect of reopening society? Are we doing it in terms of cost, in terms of here's how many people will die or will not die? Are we saying like, oh, acceptable losses in terms of human lives? Are we talking about weighing them against economic losses? It seems to be a pretty hairy problem. Once you start saying why today is the day, and you want to give an empirical reason why, how do you talk about that? Particularly, how do you talk about it in a way that doesn't make you sound like a ghoul?
Well, I mean, let's be realistic about reopening society. Reopening society isn't going to be 0 or 1. It's going to be itself a statistical distribution. So there is, at least in the Boston area, no you can't get arrested or going out. Maybe you can get a fine if you open your restaurant. But people who making their own cost benefit analysis. So, and everybody's got their own cost benefit situation. So there's always going to be some people who reopen or stop social distancing, and other people who stay social distancing. But it will be a distribution of how much, and also of a degree of how much people go out and about and mix. So I think this is a feedback control situation. I think if you can, from watching the mixing, if you can make that visible, like here's how much mixing is happening in your area, and here's how many cases are showing up, and basically, you know, we're each making our own decision for ourselves, for our community, for our local, you know, small group, based on our own cost benefit analysis. That's the situation we're in right now. We're not in a situation where someone is taking on the responsibility or the leadership to, quote, reopen society for everybody, or close society for everybody. You know, maybe to some degree the governors are taking on that responsibility, but even there, you know, they're managing a distribution, not a 0-1.
And that's actually an interesting point. Like, we've been talking about social distancing, now social distancing, but of course, social distancing has not been enforced in some draconian sense. It's soft intervention, as we say in causal modeling. Does Ben have a notebook he can share so we can learn how he frames and estimates this COVID issue? Or will you have a notebook you can share?
Yes, we're working on that.
What's your opinion on the president planning to temporarily hold immigration into the U.S. due to COVID-19? Getting real.
So it kind of seems like unrelated to COVID-19 to me. Statistically speaking, I don't think that will have any effect on the spread of COVID. Or let me say, you know, the coefficient of the effect of immigration on COVID-19 will be 1,000 times less strong, or, you know, just hugely less strong than our own actions that we take and what we decide to do.
How do we bring into the picture the daily changes in the situation in terms of medical emergencies and lack of resources while modeling? So if we're building a model and we have these, not just say a reported that, yeah, we don't have enough resources, we don't have enough ventilators, we don't have enough PPE, but those situations are changing. The constraint on the healthcare system is changing. Or the pressure on the healthcare system is changing. I think this question is about how do we incorporate those dynamics into the modeling question?
So it seems like there are two places where the capacity of the healthcare system plays a role. So one is in the Bayesian modeling to get posterior estimates, and the second is in decision theory. So in the decision theory, if you overload your hospitals, then you have a much higher mortality rate than you could have if you flatten the curve. We all know that. So that's just a high cost for letting things go crazy. And so there we just put a high cost on letting things go crazy, which means being proactive, trying to shut things down more proactively and let them get out of control. On the modeling side, you know, there could be one district where face masks are plentiful. And even though people have decided not to stay at home and they've decided to go on, say, public transport, everybody's wearing a face mask. There could be another district where, for whatever reason, the shipment fell through, there are no face masks, or people, you know, they're not available or something, or even in the hospitals, there's a large hospital and the people there don't have enough personal protective equipment. So the spreading is higher there. So that would affect the dynamics, right? Every vicinity has a different healthcare system, you know, that both controls the spreading as well as controls the effects of people getting sick. And personally, I think I don't know how you estimate those variables. So I haven't figured out a way that you could observe in any way, shape, or form, like what percentage of people are wearing face masks when they go out, for example, or what percentage of hospital workers have adequate protection, or even just the types of procedures that one hospital is taking that another hospital isn't. You know, maybe one hospital was able to create a new ward in their parking lot or in one of their wings specific to COVID. Another hospital didn't have that space, couldn't do that. So it's very difficult to model. And that goes back to the beginning of our conversation where we said, you know, sometimes a simple model, you know, not getting too technocratic about things, you know, model the things we have the power to model and the acceptance to accept the things we can't model and the wisdom to know the difference.
You know, I mean, I think this, so one of the next question here, I think, is a interesting kind of controversial question, which is there a way we can prove with high confidence that China's numbers are fake? And I'll throw an answer at this. If you wanted to prove anybody's numbers were fake, say any business were saying like, yeah, we're going gangbusters, we're selling a lot of product, go and sit in front of their warehouse and see how many trucks leave the warehouse. If those two numbers don't match up, then you understand that there's a problem. But then you actually have to go and sit in front of the warehouse. And so that gets to a point, you know, how do you measure those things that are, you know, how much gear is in the hospital, how much stress is on the hospital at any given hospital? You can go and collect that data. You can go and sit and you can design a study. We do this all the time in public health and in general statistical applications, which is to say like, okay, I need to go and design some kind of sampling procedure where I'm going to, in an unbiased way, go and collect some data points and then make some generalizations from that data. So this is something that we could do, particularly if we had some organized leadership around the problem to say, let's, rather than being passive and just kind of modeling what's reported, we can be active and go and create mechanisms for collecting the data that we need to make our decisions. One final question, is there any connection between COVID spread and location? So, well, I think the answer to that is yes, but as you were saying, different places are going to have different infection rates. It's kind of why we're interested in this mobility data. Is there a way of...
The bottom line is COVID spreads like wildfire everywhere. And, you know, to aggregate these two questions together, you know, the way we estimate whether China numbers are fake, whether spreading varies on different locations is you rerun as scientists, what do? We try to reproduce an experiment. We rerun the experiment and we see if we get the same outcome in both experiments or multiple experiments. So we've now rerun the experiment in Iran and we have satellite photos of mass graves. We've rerun the experiment in Great Britain and we have a prime minister who's probably pretty well cared for and protected, who's, you know, critically ill. We've rerun the experiment in Italy and we've seen massive numbers there. We've rerun the experiment in New York City. I mean, I don't know how many more times we need to rerun the experiment. There's no way that those things could have all happened the same way if it wasn't incredibly infectious and if it wasn't spreading to a lot of people who don't show any symptoms. Like, period. Like, there's just no way you could get death rates, like the actual numbers of fatalities that we've directly observed from, you know, running body bags. There's no way you could get that. I'm not the only one saying this. Like, every scientist, epidemiologist that I've seen who's studied this, and the all modeling I've done has all just shown this. Unless there's a bunch of people going around spreading it who don't know they have it, there's no way this could have happened. We've reproduced that scientific study, you know, 5 or 10 times now.
I'll end on that somber note. Thanks a lot, Ben, for doing this. This is great. You know, unfortunately, that's probably the sound of another ambulance going by, just to kind of put up some punctuation on that point. I want everybody who's listening to stay healthy, and I will post in the show notes links that were mentioned, and eventually when data and notebooks are released, I'll send those out as well. Thanks a lot again, Ben.
Thank you, Robert.